Hello, this is Dr. Peter Balogh of the Vancouver Centre for Cosmetic and Implant Dentistry. I want to do a couple of videos today regarding your bite, people's bites. A lot of times people come in with some pain, discomfort, either associated with a single tooth or with their entire jaws, earaches, jaw aches, headaches, those types of things. And sometimes it can be a sign of something more ominous, something more serious going on. A lot of other times it can be something just very simple or relatively simple related to your bite. So I wanted to talk about that today. And before I do, I just want to draw attention to one book that if you haven't ever seen or read, this is a very good book written by Dr. Jerry Simon. It's almost 20 years old. It talks about some of these things, mostly related how people have clenching, grinding issues and how it relates to their headaches and such. I'm going to touch a little bit more, a little bit different, so some other things that I've learned since I've even come across this book. So I'm going to break this video up into two videos. Part one, I'm just going to give you some anecdotal histories of some real life patients that I've treated and how we've been able to resolve their issues. And then in part two, I'll describe a little more detail about what we actually do, what the problem is with the bite, and how to actually treat that. So first of all, the first history I want to talk to you about is, I won't say the names, but it's a patient, a 60-year-old female patient, came in with terrible pain going on for about the last week and a half on her lower right molar. And she described the pain as about a 7 or 8 out of 10. And it was just throbbing constantly, sensitive to hot, sensitive to cold, and she just could not chew on it. So she came in, and as a dentist, the first thing we think of is this sounds like a root canal. So anytime somebody got some pain that severe, there's either a really large cavity or there's a root canal or something more serious going on. So I took a look at the tooth and it's got a gold crown on there. Perfectly good crown, fits really, really well. No problems with it. No decay. The gums are healthy. Yes, when I tap on the tooth, it's sore, which also indicates that maybe there's something going on there. Tested the tooth told me that the nerve was still alive. The person could feel hot and cold, but I couldn't understand why this tooth was giving her so much trouble. Took an x-ray, of course it looked fine on the x-ray, and so looking and say, well, why did this tooth all of a sudden come out of the blue start giving her discomfort? So looked at one more thing, checked her bite on the tooth, and I noticed something was not right with the bite on the tooth. Very subtle, but it was definitely not ideal. So did a look. I said, I offered to her, said, you know what, this tooth might need a root canal, but I can do one thing. Let's do a little bite adjustment. Let's see what happens. And if it doesn't settle down, no question, you come back, we're going to do a root canal on that tooth. Or besides root canal, the only other option is to take the tooth out. So that's what we did. I did a little bite adjustment. I didn't see her until about a week later, not in the office, but outside the office. I happened to meet her at another occasion, and she said, you know what, that tooth that would have been hurting for 2 weeks, the next day it was perfectly fine, and I've been eating on it ever since. And all I did was a little bite adjustment. So that's the first case. Second case I'm going to bring up is a young patient in his mid-20s. I did a small filling on him on an upper molar, and it wasn't that big of or deep of a filling. But he said that afterwards it hurt to chew. And of course, the first thing we think of as dentists, okay, is there a problem with the filling? Was it too high? So had him come in, adjusted the filling, and it didn't look high, but I thought I'm going to adjust it anyways, make sure it's definitely not a problem. And looked at everything else. The filling looked fine, looked like it was properly bonded, all those sorts of things that we would normally eliminate. And he came back a week later, and basically he said, yeah, it's a lot better, but it's still sensitive. Just, I can chew soft things, but anytime I chew something hard, it's still sensitive. And it's a little sensitive to cold as well. So I took another look at the tooth, checked the bite. Certainly the filling was not an issue, but I took a look at some other aspects with the bite on this particular tooth. And I said, I see something else that might be amiss. Let's try this another adjustment and see what happens. Sure enough, as soon as I did that adjustment, a week later, problems were gone. Almost similar to the case before. Third case I'm going to bring up is a patient that I saw who was not a patient of mine, 70 years old. She had, I believe, 3 implants, if I recall correctly, because it was a few years ago, on her upper right. And they'd been in place for at least 15 years, and she'd been doing fine with them for many years. doing perfectly fine. But she said for about the last 5 years, she couldn't chew on that side. It was giving her all kinds of pain. Every time she would bite, it would hurt. And so she went to her dentist. The dentist took x-rays, took a look, couldn't find anything wrong, and said, well, I can't see anything. Let's just do a bite adjustment and fix it that way. Well, it didn't get better. So then they referred her to another dentist, a specialist. They couldn't find anything wrong. And to make the story short, over the course of 5 years, she had seen about 3 or 4 different dentists and specialists, and nobody could figure out what was going on and why she was still having pain. And basically, the last person and a couple of them conferred, a couple of the professionals conferred, said, you know what, let's just take the implants out. So I had met her at a social event, and she told me the story. And I asked her some questions. I said, you know what, before you go and take those implants out, from what you describe, I'm not so sure that it's really a problem with the implants. You spent a lot of money, a lot of effort to get these done. They were fine for many years. And unless you've got these other signs and symptoms, I'm really questioning if it's truly the implant. But come on in, let me take a look. So she came in about a couple weeks later, took a look, and sure enough, on the x-rays, the bone was perfectly good. The tissues were healthy. Everything looked good. I looked at her bite. It looked okay. And I can see where some adjustments had been done. It did look okay, but I thought, well, maybe there's still something with the bite that, something very subtle that the other dentist didn't pick up on. And it's not that I'm, any smarter than any other dentist. I just happen to be very fortunate to have learned some of these things in my 30 years of practice. So she said, okay, fair enough. Let's do this. I mean, worst case, you go back to your other dentist, they take out the implants. Let me do these adjustments. So I did some adjustments. And I said, come back in 2 weeks and tell me what, we'll follow up and see if it's any better. So she came back 2 weeks later, and she said, you know what, it is 75% better. She can chew on these teeth now, whereas before she couldn't chew on them at all. She said it's 75% better just in that length of time that we'd done the adjustments. So I said, okay, that's wonderful. Let me do one more adjustment. Let me check it again. And sure enough, I could see some other things. And we did another adjustment. And then I never actually did see her again after that. I saw her again at a social setting about a year later. And she said, you know what? My teeth have been fine. Implants are fine. She didn't have to have them out. And so she's been functioning ever since. Now, that was a few years ago. I have seen her. I bump into her once or twice a year. She's got her own dentist. And everything's still fine. Everything's working perfectly well. So that's another example of where somebody has had some very severe pain and not really diagnosed as far as what the actual problem was, and a simple bite adjustment fixed the problem. I'm going to tell you another case here. This was a young patient, upper molar. She said it was hurting once again, too hot, too cold, too biting. She couldn't chew on it. And every time she tried eating even the softest things, it hurt. So took a look. She had a small filling on there. Everything was fine. Couldn't see anything wrong with the tooth. And I said, I don't see anything wrong with the tooth. She was convinced she had a huge cavity on the tooth. That's the type of pain that she was having. I can't remember how she described it out of 10. I think it was definitely a 6 or 7. It was certainly nothing small. And sure enough, the only thing I see was a bite issue. So I did a bite adjustment. 2 days later, I followed up with her. Problem was gone. Another example, I'll tell you, it's actually has to do with my own teeth, my own self. I have an issue where I grind my teeth. I did this, I've been doing this pretty much most of my life. And I unfortunately worn down my teeth long before anybody had told me what was going on and that this was going to be a problem. Anyway, so I wear a night guard. And I've been wearing a night guard for many years. I had some dental work done. And when I had the dental work done, I was frozen on the upper left. And after everything was done, I could say, my bite doesn't feel right. I was telling the dentist, my bite doesn't feel right. So he took a look and said, no, your bite's fine. Your bite's perfectly fine. It looks good. All the marks are okay. He says, no, I can tell there's something not right up in the top left. So anyways, I left it. And afterwards, the numbing went away. A couple of days later, I said, you know what? I've never really noticed it before, but there's a spot there which is interfering with the way my teeth come together. So I don't recommend anybody doing this at home, but as dentists, we sometimes will fix our own teeth. So that's exactly what I did. I knew with the spot I had to do a little fix, a little repair, and I did just that. And you know what? All of a sudden, some of the tension and pressure that I had in my jaws was gone. I could feel my teeth fitting better. I could feel my bite fit better. And it was just a couple little adjustments. And I don't recommend this as a general rule, but I used to wear a neck guard routinely every single night. And this is about 4 months ago. I haven't worn my neck guard since. And I could tell I was grinding. I could almost tell every night when I was grinding. And I'm taking a bit of a chance here. I'm kind of playing or experimenting with my own teeth. I haven't been grinding since. So for people, my patients and others who don't like to wear a night guard, and we as dentists have recommended you got to wear a night guard because this is an ongoing thing, this may or may not be a solution, but I just say that with a bit of caution. Okay, I've got a couple other cases I can just mention. I have a lot of times I have people come in, maybe not with sore jaws or sore teeth or sensitive teeth, but that's often part of it. But headaches, jaw aches, sore aches up in here, headaches, and they can't figure out what's going on. We take a look. There's no problems with the teeth. Everything looks okay. We check some of the muscles, and sure enough, all the muscles are sore. So it's an indication of some clenching and grinding. And start looking. Okay, well, why are they clenching and grinding? And as dentists, we've always blamed it on stress. It's the bite or stress. We tend to label it more as on stress and say, okay, some people will get, and I've said this how many times, some people will get ulcers, some people get high blood pressure, other people grind their teeth. We all deal with stress differently. That's how you deal with it. So you know what, here's a night guard, and that will at least keep you from wearing down your teeth. And that's a good solution, but I'm starting to look at it more as we're treating the symptoms and not the cause. So anyways, I've had people come in where they've had these issues, and I take a look and I say, you know what, I see some things that may be a trigger for your clenching. And this comes with what I learned even with my own teeth. And explain it to them and say, okay, fair enough. And so we've done the adjustments, and I follow up with them, and lo and behold, they say, yeah, you know what, my teeth feel better. And oftentimes they'll tell me right away, so you know what, right after this adjustment, oh gosh, my teeth feel like they're fit. They feel a lot more like they're fitting better. They're a lot more loose. They're not so locked in place. And this is all related to this little adjustment that we do. Lastly, I'll mention a case. That was a patient of mine I did some work on. And he always felt his bite in the back was heavy. And sure enough, he had implants in place. He kept fracturing off the porcelain and chipping the porcelain. And I would check the bite. Everything is fine. Couldn't figure out. This is going back over 10 years ago. And for like 6 months, I couldn't figure out what was going on. I kept having to repair these teeth. I'd send the crown back to get it fixed. And one day I said, okay, I'm just going to have to adjust this to the point where it's going to be extremely light in contact. And normally we check the bite, put it in place, and then take a look. This time I put the paper that we use, the carbon paper that we use to check his bite, and I watched to see how his teeth are fitting together. And there was actually a gap between his upper and lower teeth. And I said, okay, tap. And he would tap, and these teeth would not touch. He said, okay, that's good. And I said, something just dawned on me. He said, okay, now I want you to clench your teeth, because this person does clench his teeth. You can see it in his jaws. You can see it in his muscles. The evidence was there with what he did with his old teeth before. He'd worn them right down. And as he would clench, all his teeth would touch. And then these other teeth, which there was a gap, they would actually come together and make contact. And that opened my eyes to something I had learned many years ago, but it was the first time I'd ever seen it in real life. Is there's something called mandibular flexure. And we think our jaws don't flex. We think the bones are rigid and they don't move. Well, that's been disproven, and it's been shown that in some cases, our jaws will actually flex. And so people's teeth will fit together, and you would think, okay, this is how your teeth fit. Well, this person would close, there'd be a gap there, and as he would clench hard, his teeth would come together, and that's why he was fracturing off the porcelain in those areas. So once I realized that, I did a further adjustment. Fractures have been pretty much eliminated. So I've got a whole bunch of other cases I could talk about, but I just wanted to touch on a few of these different types of cases that we see that I feel are related to a person's bite. And if we do these adjustments, we can eliminate the source of what's causing the discomfort, whether it be it in the teeth, be it in the jaws, be it chipping and breaking and fracturing of teeth. And as opposed to what we sometimes would look at and say, gosh, I don't understand, but you've got this terrible pain, something's going on with the nerve, we might have to take the tooth out or do an extraction. So in part two, I'm going to explain a little bit more detail of what this involves. And of course, you need to have your dentist take a look at this and really take and see, is this really the case? I mean, I can't say that everybody comes in with a toothache, it's a bite problem. Absolutely not. But certainly, this needs to be as one of the things in our what we call a differential diagnosis that we have to look at and eliminate. So stay tuned for part two, and I'll do a bit more of an explanation of just what it is that we do. Thank you.